go ahead, like, comment, share as is appropriate. All right, so good evening again, everyone. I'm Dr. Felicia Adderley. I am a Bahamian born and raised U.S. trained physiotherapist, and I help people take control over their lives after injury or trauma and go back to living a high standard of their lives and doing the things that they love to do. I've helped hundreds of patients reach their physiotherapy goals over the last 8 years. I have a bachelor's in biology / pre-physical therapy and a doctorate in physical therapy. I'm a certified kinesiotaping practitioner, and I hold a manual lymphatic drainage certification. I have attended countless courses in cancer rehabilitation, lymphatic drainage, and hand therapy. I have been a licensed physiotherapist for 8 years, and I've been running a successful private practice for 4. So that's just a little bit about me, and I'm going to go ahead and jump right into our topic this evening. And so our topic is going to be 7 myths about physiotherapy. So the first myth, I'm going to get right into the first one. The first myth is that physiotherapy is a passive activity. So it's called physiotherapy here in the Bahamas and in most countries outside of the US, but it's called physical therapy in the States. Physical. That means you're doing something, right? So it's not just going to be a rub down. Okay, so if that's what people sometimes come expecting, sometimes it's a minor, shock for them, okay? But they usually quickly get over that. And what people really can expect when they come is exercise, manual therapy, for those things to really be a large part of their treatment protocol. And really to get the results and the relief that really last, strengthening is really important. Correcting the underlying issues that really made a person need therapy in the first place. So it's not really enough to just deal with the surface. You have to really get to the root cause and actually correct that in order to really get a result that's going to last. Certain of the other things, yes, rub downs feel nice. I love the spa personally. I love massages. But, I feel that those things have their place. And, to really, if someone has a serious issue, massage alone is not going to correct that. Do therapists or does therapy sometimes incorporate that? Yes, but it's only a part of the treatment. And I don't personally consider it to be the main part. But it's nice to use it like as an adjunct or to go along with, but not to say, well, oh, that's all that a person is going to do when they come to therapy, because that alone will not correct their issue. All right. So yes, the things like the massage, the TENS, the heating pad, the things that really feel good, but their effect is short term. It's not a long term effect. So if a person really has pain after a short period of time, then they may feel good like initially, but after a couple of hours when that wears off, then they're really kind of still back to having that pain that really took them to the therapist in the first place. So for instance, let's say a person has a torn rotator cuff. Massaging, heat, and e-stim alone can do the trick, okay? And that can help them regain their function that they would have lost, not by itself. So strengthening the muscles that are around the shoulder, that would be something that is helpful in order to help them to regain their motion, regain use of their arm, things like that. So that was the first myth, that physiotherapy is a passive activity. It's not passive. It's something that you have to do. So of course, with the instruction of the therapist, we'll give you guidance as to what are the correct things that you need to be doing. And then you should be making progress through the therapy every week. Okay, so our second myth. The second myth is that it's going to hurt. So a lot of people come to the first session and they're expecting to be in a lot of pain, or they're expecting that the process is going to be painful every day when they come. And that's really not the case. Sometimes pain is a part of the process, and often when the evaluation is going on, the therapist is going to do various tests. We call them special tests that are meant to really recreate the patient's pain. This is to help pinpoint what are the structures that are involved or that have been affected by the injury and that are contributing to the patient's condition. Then an effective and focused treatment plan can be developed. So it's very important information for us to have, and that's also why evaluation is important. Uh, I would say especially when I first became a therapist, I noticed that people would sometimes expect to jump straight into treatment on the first date. But you have to know what you're dealing with first. You have to know what's the problem in order to create a plan then to solve it. So something I spoke about on the live stream last week was that persons that we need to set up the expectations from the first visit. So what I normally would tell persons on the first day is that the first visit is going to be different from all of the other visits, and that the other visits would be more treatment based. But the first visit is really the talking visit, and that's where we would go ahead and get the baseline. We take a lot of measurements, so we have to see where the person is starting so that we know and we can make an effective plan for where they're going. So you can't just start to treat just maybe even based on a diagnosis on a referral form. You have to really get in there and find out what is wrong with the person, what's contributing to their pain. Yes, the person may have low back pain or they may have shoulder pain, but why? What are the structures that are involved? What are the muscles that are weak? What are the ranges? What are the directions in which a person has a loss of motion? What are the things that the person cannot do functionally? So we need to find out all of that information in order to really create an effective plan so that we can really help the person to the best of our abilities. So I like to set that up from the first visit. And one thing that I do also tell patients that if we do anything and it does aggravate their pain or cause their pain level to increase, that we'll do something. I promise them that I will do something to help that to kind of calm down or come down before they leave that day. So it's like a nice trade-off. Yes, sometimes it's painful, but most of the time our treatments are not meant to actually be painful. Okay. Although there may be some painful days, that's not the goal. The goal is not pain. One of the goals is usually pain relief, right? So the goal is that at the end of the whole therapy process, that the pain is less often, and then also less intense. All right, so we also often have to distinguish what is pain and what is just muscle ache, because a lot of persons do confuse the two. And when you really ask a person, well, is that really painful or does it just feel like you worked? Okay, most of the time they say, well, it just feels like I worked, which we expect. So we know that if we go to the gym, we work out, usually you feel some soreness later. And we would consider that to be normal. I would say for about a day after exercise, that's to be expected. Not to say much longer than, 2 days, then, you're getting into delayed onset muscle soreness, and that's another situation. But that's not really the objective. So that's something that maybe, you have to look at. And it's also very important to always get that feedback and give that feedback as a patient to your therapist so that they know, how the treatment affected you. So if the plan needs to be adjusted as you move forward. So the point is not to be painful, the point is to be better. All right, so that was number 2, that the therapy is going to hurt. The therapy doesn't have to hurt. That's not a requirement. All right, so the third myth. The third myth is that therapy is a quick or an instant fix. Physiotherapy is not quick oats. Maybe more like old-fashioned oats, okay? So you're going to need to let it simmer for a while. It's not an automatic thing. It's not an instant thing. So one question that's important to consider is how long a patient has been injured or they've been having pain. If it's been a long time frame, let's say you're getting into 6 months to a year or more, then it's not reasonable to expect to be back to quote unquote normal in a week or two. If a person has been injured for a really long time and maybe they've been weak for a really long time, then it's not realistic to expect to bounce just like that. Does it happen in some cases? Yes, probably in a few cases, but more often than not, it is going to take some time. Okay. Uh, Maybe it's not, maybe it's even going to be longer than a month. In many cases it is. But it does depend on many factors. Okay, so healing rates can affect, depend on a lot of different things, age, nutrition, how active a person was before injury. So all of those really affect how long a person may take to recover from an injury. And that's a whole conversation in and of itself. But we just need to be realistic about it and understand that results that are going to last, it actually does take time and consistency in order to achieve. All right, so I do encourage people to be patient and to give it a chance, give it a chance to work. They should start to see some small changes and improvements at least weekly. I like it when people can see something every week. Let's say they notice something that they couldn't do last week, they can do it this week, or something that they did it last week, but it was really painful. They could do it this week and it was not that bad, or it was okay, not painful at all. So even if it's something like functional activities that are becoming easier to do on their own. Or for example, let's say if at the first visit they say that, okay, well, I can only stand up for about 10 minutes before I get painful. So maybe, you set a goal and you check, and you reevaluate them as you're going along, and you find out now that, hey, this person can now stand up. The time is now increased to 30 minutes that they can stand up before they get painful, okay, during the course of the therapy. So something like that, when you hear that, that's a win. That's positive. That's moving in the direction that you want the patient to move in, which is they're getting better. Okay, so that was myth number 3, that it's a quick or an instant fix. It does take time. It really does. All right, so that's 3 myths so far. Any questions so far? If anything is not clear at all, just feel free to go ahead and put it in the comments so that I can address your questions. All right, looks like so far so good. All right, so on to myth number 4. Myth number 4 is that the pain is never coming back. So when a patient successfully completes their therapy sessions, they must then be prepared to carry on what they have learned in therapy. They have to keep going. So therapy isn't necessarily something that persons have to stay in forever, or we, really are expecting persons to come back, um, come back every month, come back once a month, every month for 2 years. And that's not really the point of therapy, and it does differ from other disciplines in that way. Because, what we really are seeking to do as therapists, we seek to help persons get past that acute stage where they're very painful, back to a stage of independence, prior level of function, and then to have them leave therapy, kind of graduate with the tools that they need to carry on with their lives. Because let's face it, we do all have some pain some days, that does happen. Okay, so I almost look at that as like a part of life. And I tell people that if we're here long enough, we are going to experience some aches and pains. That's a part of life. So what people are encouraged to do, and what's a nice goal for persons even as they kind of graduate or matriculate from therapy back to regular life, is that they take part in some form of physical activity on a regular basis. So the recommendation for exercise is that it's going to be a total of 150 minutes of moderate exercise per week. So what you're looking at is going to be, you could break that up any way that you like, and you can pick any activity that you like. So sometimes I tell people, well, it might be nice to break it up 5 days a week for 30 minutes, or you could do, if you want to do a longer session, you could do less days. But however, and of course, it's also fine to do more than the 150 minutes, even better, right? Because it has a lot of benefits to be exercising. You have a natural method of controlling blood pressure, diabetes, you have better cardiovascular health, you reduce your risk of cancer. So exercise is good for a lot of different things, right? But as it relates now to exiting the therapy and going back to regular life, then a person needs to be doing some regular exercise. So this is so that the body does not become weak again, right? Because you come to therapy, you strengthen, and then what happens? What happens if someone that used to pump iron in the gym 5 days a week just stops cold turkey? They do absolutely nothing. And of course, they're going to lose a lot of muscle mass. So the same thing is going to happen, right? If a person's body then goes back to that weaker state, then the pain could come back, right? Then the person finds that they will need to come back to therapy for the same issue. So let's say then, if a person was a couch potato before therapy, and then they go back to being a couch potato after therapy, even if, they were going through the therapy, by the end of the therapy, they felt great, but they just stop, because they feel fine. So when the pain goes away, then, a person may be lulled into a false sense of security. So what happens is they go back to being a couch potato after the therapy, and then they will eventually be back to square one and back in therapy. So what I usually encourage persons to do, I would tell them to pick an activity that they like, because if it's something that they like, they're more likely to stick with it. But of course, if you pick something and it's a chore to you, then you're less likely to actually stick with that. You may do it for a brief period, but that consistency is what you're really looking for. That's what you really, really want. Something that you can stick with basically for life. Okay? So if a person likes swimming, I tell them to go ahead and swim, right? It's an excellent total body activity. And if you don't like that, then go ahead and pick something else. Whatever it is, running, jogging, walking, go into the gym, doing Pilates, whatever it is. Just pick something that's appropriate. And I also encourage persons that if they're working with a trainer or in a group setting, that they do make their trainer aware of any of their pre-existing conditions, injuries, so that they can get whatever modifications they may need, so that they are not going to hurt themselves or re-injure themselves. But, the person that is working with them really does need to be aware of what are all the things that they have going on medically and physically, so that they can, once again, design something that is tailored towards that person and that is not going to harm them but help them. So that transparency is really important. So also, what helps with keeping consistent with exercise after therapy would be having an exercise or an accountability partner. Uh, we don't always feel like exercising every day, every week. You don't always feel like it. But sometimes when you know that you have somebody else and it's almost like, oh, well, I can't flake out on them, or I can't disappoint them. I don't want to disappoint them like that. And they're really for it. They feel like going today. I don't want to hold them back. So sometimes, and maybe you need somebody else to give you that encouraging word to kind of like nudge you, like, okay, come on, let's go. You need to do this. So let's go ahead and get out there and get going. So it'll give you that get up and go on the days that, let's tell the truth, you just don't feel like it. All right. So that is 4 myths so far. Myth number 5. Myth number 5 is that therapy is only for when there's an injury. This is not the case. Therapy can also be something that is preventative, right? If you're involved in a sport, you can go to therapy to learn how to strengthen and how to stretch the muscles that are specific to the sport that you play. For example, it could be track, it could be golf, it could be high jump, basically any sport, right? And then also therapists often speak to the need for proper warm up and cool down. I know that there are a lot of people that will just kind of just go at it and just start to exercise, or just kind of break out and just start running. People may also do just a little, couple seconds stretch, one stretch here, one stretch there, kick their leg 1 or 2 times and, kind of feel like, okay, that's adequate. Let me get going. And Oftentimes that's really what causes a lot of people to get injured, is not having a proper warm up and cool down routine, right? But a physical therapist can really assist in helping a person that really needs to have that kind of complete system and complete approach to it. So warm up, then do the exercise or activity in a way that, shows that you have good body mechanics, so that you're protecting your joints while you're doing these different sporting activities, and then having that, adequate cool down after the fact. So those are all things that are important, not necessarily just the sport or the activity itself, but also what you would do before and after that. All right, so that's 5 myths down. All right, on to myth number 6. Myth number 6 is that therapy is not as effective as surgery. So conservative measures such as therapy can be very effective, and they can provide good outcomes and results. This is without going under the knife, having a hospital stay, taking weeks to months off work, and having a long recovery process. So often, even after having surgery, physical therapy is still needed in any event. So that's then to optimize the results with the strengthening. A lot of persons then need to learn to walk again, or correct any gait pattern that they may have that may be an incorrect one. So manual treatment, range of motion exercises and activities and such. Okay, it's really worth going to therapy and at least giving it a try. I've seen many people have success with therapy and really not need surgery at all. And really, when you look at it, what does a person have to lose? You know, I mean, there's really nothing to lose, but a person may be able to avoid surgery altogether. Now, there are some severe cases, of course, when surgery is going to be indicated. I usually tell people that if they can't get any relief, like they're saying that they can't get any sleep at night, they're in pain all the time, basically 24/7, uh, you know, because the pain it's just so bad. It's that bad. It's affecting their function. They can't think. If that's very bad, and if that's the case and that like persists for a longer period of time, then I would say that that's a case where a person really needs to consider, having surgery. And I would always encourage persons to do their due diligence. If they can talk to anybody that has had perhaps the same surgery, make sure that they do their research, do their homework, and really ask the necessary questions about what they can really expect as an outcome following the surgery. Because I do believe a lot of people think the surgery is going to correct everything and they'll be back to 100% instantly, and that they're just going to come skipping off of the operating table. So it's important to really know, once again, set up what are the realistic expectations before going into surgery. So that was myth number 6, that therapy is not as effective as surgery, and research shows that it is. The research is really there that supports that. All right, so on to myth number 7. This is our last myth for the broadcast. So, myth number 7 is that you have to go to the therapy clinic that is on the referral form. So, it's actually the patient's choice where they go for therapy. Here in the Bahamas, you do need a referral from a physician in order to get physiotherapy. However, where you take that referral is actually up to you. So it's up to the consumer or the patient or the client to consider where they will be comfortable going, where they can get competent care, personalized attention. The person or the patient may also want the opinion of someone that's had therapy before, right? because then that person can kind of give you their perspective. It's similar to, speaking with someone that's maybe had a surgery before that you're considering having also. So you want that. It's basically like an unbiased opinion. You want to get that from someone that you trust, someone that you know may have had occasion to have, in this instance, therapy before. Find out what their experience was like, what was their take on it, and find out if they themselves would go back to that place if the need was to arise. So I would say also these days that people would utilize a lot of online search engines, social media to get information on different businesses. Just on the whole, that's basically how the world and how people operate now. So the therapy is no different. So people will tend to check things out online and see what are the reviews that are available, and help to make their decision based on that. All right. So those are the 7 myths about physiotherapy. I'll go back and just quickly give the points again. So the first myth was that physiotherapy is a passive activity. The second myth is that physiotherapy has to hurt, or it's going to hurt. It's actually it can be quite fun and quite enjoyable. And that's what I have been told by my patients over the years. Myth number 3 is that therapy is a quick or an instant fix. Myth number 4 is that the pain won't ever come back. Myth 5 is that therapy is only for when there is an injury. 6, therapy is not as effective as surgery. And final myth number 7 is that you have to go to the therapy clinic that is on the referral form. So you can take your form pretty much wherever you would like to go, no matter what name is printed on it, or if it's on the physician's personal prescription pad. Once you have a referral, then you're eligible to go and get your therapy wherever you feel comfortable going. All right, so those are my 7 myths for this evening. If anybody has any questions for me right now, you can go ahead and put them in the comment section now. Otherwise, I'll give that a few moments to see if anybody has any questions. And of course, remember, Adley Physio, you can always join our mailing list if you want to be sure that you never miss one of our broadcasts. If you have any other topics that you'd like to talk about, then feel free to go ahead and post that as well. And I can do it and plan the topic out for a future stream or broadcast. Adley Physio, you can also stay connected with us by following us here on Facebook. If you want to get the notifications when we're streaming, make sure that you follow us. And I think there's also a way for you to kind of click to get the notifications, and maybe a bell that you can click so that you don't miss the notifications of the streams. So you can link with us here on Facebook on Adderley Physio. You can link with us on Instagram, YouTube, Pinterest, TikTok. I'm on LinkedIn as Dr. Felicia Adderley. I think that those are our major platforms that we're on. All right. Checking the comments. I don't see where anybody has posted any questions up to this point. All right. So thanks for those that were able to come on. If there are no questions right now, I'm going to get ready to sign off. Again, you can always connect with us in case you think about anything later after this broadcast has ended. You can connect with us in several different ways. You're also welcome to join our email list so that you can get notifications. Once again, I usually blast it out thanks Betty, I will usually blast out an email prior to coming on, as well as we post a lot of useful posts and information on all of our platforms. All right. I don't see any questions here, so I'm going to get ready to sign off. Everybody, please have a good evening. Stay safe out there. COVID is not over, so continue to stay safe. I know it is tiring keeping up with Thanks Vandia. It's a lot to keep up with all of these precautions and things like that, and it's easy to get tired and kind of fall off, but do everything that you need to do to keep yourself and those around you safe. Wash those hands. Don't touch your face. Don't go anywhere that you don't really have to go. Try to minimize your outings, etc. Okay. Also, if you're interested in any COVID related information, whether that is you want to talk about the vaccine or any of the news, anything that's going on, anything about immune system, feel free to contact me and I will go ahead and put together that topic for a future broadcast. All right. So thanks for coming on, everyone. Thanks for your time. Hope that it was informative and that you learned something. And have a good evening, all, and a great Friday and weekend. Stay safe.